2022. I actually need to say happy Mashujaa Day to you. I hope that you're well, that you're relaxing somewhere. Okay. Well, not everyone is relaxing. I am also here. But anyway, it is refreshing to be in your company on Hope FM. My name is Sharon Aitore. You can listen to us from any part of this world by streaming us live on www.hopemediakenya.org. 0717-400-555 is our WhatsApp number. And of course, you can also get us on text 20933 and at Hope FM live across social media. It's a joy to know that you're on the other side of this studio, and I ask that you send in those gynecological questions. And today we are talking about UTIs or urinary tract infections. And to help us with that today is Dr. Doris Mwenda, and I bring her now to say hello to us. Good morning, Daktari.
Good morning to you. I'm glad to be with you today. I'm Dr. Doris Mwenda, a resident doctor at University of Nairobi, Obstetrics and Gynaecology.
All right, great. Thank you. Thank you so much for coming, for giving us your time. And we promise you we will try and be as nice to you as is possible. And we are good people. Trust me, we are. So, Usijali, you're going to be fine. Now, today we want to talk about UTIs. It's a conversation that is out there quite a lot. Sasa hiyo ni nini? What is UTI?
UTI, it's an infection of the urinary tract system, which consists of the kidney, the ureters. They are the tubes that drain the kidneys where the urine is formed, and then the urine is stored in the bladder, and then it is secreted through the urethra. So when we say you have UTI, it means you either have urethritis, that is infection of the urethra, or you have cystitis, that is the infection of the bladder, or you have uretitis, that is the infection of the ureters, or you have the pyelonephritis, which can be caused by either a bacteria or also a cyst.
Okay.
Yeah.
All right. So the cause of UTI is either cysts or bacteria.
Yes.
That's just about it.
Yeah.
Okay, tell us about, now I wanted to ask about the causes. Na sasa umeshasema ni bacteria na cysts. So I'm wondering how to put it in a way that we understand what is it that we do or don't do that causes probably this bacteria to grow or to thrive, or the cysts that you're talking about.
Okay, so as we've said that UTI is caused by either a bacteria, which are so many, or a yeast. These bacteria...
You said yeast.
Yeah, yeast.
Okay.
Well, then if it is yeast, it is called candidiasis.
All right.
If it is bacteria, we call it bacteriuria. So how do you get this infection? What do you do? Or what don't you do for you to get the UTI? As we've said now, if you have... Like now, if the hygiene... someone should have good hygiene for you not to have the infection, because the system of the the system of urination and that one of the passing stool is almost the same place. So when you have poor hygiene, the bacteria from where we pass stool and where we pass our urine will come up once, and then they cause the infection. So mostly it depends on our hygiene. Yes.
Okay. All right. So what exactly are you saying we should or should not do?
Not to have the infection. We have factors that we should do to reduce the risk factors. So one, we should take plenty of water, because we want to pass as much as of urine. When you're passing urine, the bacteria are being passed out. Then we should also have proper hygiene. We should be cleaning ourselves regularly. At least take a shower twice in a day if it is possible. And then when we go to pass stool or urination, you wipe yourself from front backwards.
No, this is for women.
Yeah, for women.
Okay.
Yes. And then also when we use public toilet, make sure you wash your hands before you wipe yourself.
Okay.
Yeah.
All right. So, first of all, not first of all, but is this, one would wonder, does this infection occur both in men and women?
Thank you for the question. This infection, it occurs also in men, because as we said, as we were starting, it involves the urinary tract system. Men also have the urinary tract system.
Yeah.
They have a bladder where they have a kidney where the urine is formed. They have a bladder where the urine is stored, and also they have a urethra, plus also the prostate. The prostate lies between the bladder and the urethra. So when you have infection there, it is called prostatitis. Yes, even men have UTI.
Okay. And another question that has been asked and is quite common, what difference is there, or is there a difference between an UTI and an STI?
Yes, that is a common question even among my patients. STI and UTI, they are very different conditions. When you talk of STI, that is another different system. That is it consists of reproductive system.
Okay.
Like for women, that is the uterus, the fallopian tubes, the cervix, and the vagina. For you to differentiate between UTI and STI, because both of them, they might have dysuria, that is painful urination. For us to differentiate between these two, the patient usually present with vaginal discharge.
Okay.
Now, if the patient has the vaginal discharge, that is when we go for further investigation like pelvic examination and others. Yeah.
Okay. In that case, then, where there is a discharge, you're saying, then you're saying that it's not an UTI, but then you want to do further investigations to establish if it's an STI. That's what you're saying.
Yes.
Okay, fine. So, what are some of the symptoms in both men and women? You mentioned one, the pain during urination. Are there any other symptoms?
Yeah, there are other symptoms for UTI. There is increased urine frequency and urgency. The patient can also present with lower abdominal pain. They can also present with bloody urine. And if the infection has spread systematically, the patient can present with fever, chills, and malaise. So UTI per se, when you come to the hospital, we don't look at it as just one thing. We need to do further investigation to examine you so we can rule out other things which can cause the same symptoms, especially if someone has bloody urine.
Okay, I have had cases where the infection is recurrent. I've heard of stories and people saying that, I got it this time and then it's back. What would you say about it?
Yeah, that is a very good question. UTI, most of the time it is recurrent in 10% of the patient, mostly because you've been prescribed for antibiotics. You've not completed the dose of antibiotics. If you're told by your doctor to take the antibiotics for 10 days, you take 5 days, you feel like, nimepona sasa. You stop taking your medication. That is one cause of recurrency. Another cause of recurrency is maybe the antibiotics that you're given, they are not effective to that bacteria. So, as we said first, UTI can be caused by either bacteria or yeast. So, maybe we are treating yeast with antibiotics. And also, someone is taking the drugs, and this person is not maintaining the hygiene. So, still, we are treating and causing more infection.
Okay.
So, to prevent that recurrency, I know someone may wonder, so now it has recurred, what should I do? So it is good if it recurs, go back to the hospital so we can do further investigation like urine culture. The culture will help us to know which bacteria or which yeast is affecting this person. And when we know, once we know, we are able to give you the specific drug against specific organism.
Okay.
Yeah.
And are there times, I don't know if times is the right way to put it, but are there situations that make one more susceptible to it than others?
Yes, that is a very good question. There are situations that we call them like risk factors.
Okay.
What are the risk factors for someone to have recurrency or have UTI? For instance, taking a lot of sugar.
Oh,
because sugar increases.
Guys, did you hear that? Sugar. Okay.
Taking a lot of sugar, it increases the level of sugars in the urine, in our system.
Okay.
In the urinary tract system. So the bacteria which are there as normal floras, they will feed and flourish on that sugar, and will have the infection. Another thing is stagnation of urine within our bladder of the system.
Okay.
You're not taking plenty of water, so the emptying will be reduced. Also, conditions like diabetes, the sugar level is high. Pregnancy, the uterus, when the person is pregnant, it compresses on the bladder, so the emptying will be reduced. Also, some conditions like cancer. Cancer can also cause urinary, put you in a risk of getting the infection. Any situation that causes obstruction to the urination can cause UTI.
Okay.
Yeah.
I was going to ask about pregnancy, because this is somewhere else I've had countless people say that when I was expectant, UTI and all. And I don't know if there's anything more to say about that would help us understand a bit more why so much in pregnancy, or now what do we do? Because now, fine, I am expectant, right? And I have to carry this baby to term.
Yes.
So how do I work backwards to make sure that then it's not coming back again and again?
Okay. So as gynecologists, we have a protocol. Every first trimester and second trimester, we usually screen pregnant women for UTI. We do what we call urinalysis. So we are able to detect if the patient has the infection early, and then we treat. So as I said, the pregnancy itself, it causes the stagnation of, I hope you get what I'm saying. So the urination will be delayed. So we'll have the proliferation of the bacteria within the system, making the pregnant situation more susceptible to UTI. So as I've said, we do for them the urinalysis. Some of them, they are symptomatic, no symptoms, but you find leukocytes within the urine. So when we find them, we treat. For a pregnant person, we have to treat for the infection, because as UTI can cause serious things in pregnancy, which we don't want to. As you've said, we want to carry this pregnancy to term.
Right.
So we have to screen for our mothers to prevent the bad outcomes during the pregnancy.
Yeah.
Yes.
Okay.
I hope I've answered your question.
I think you have. So the emphasis here is for expectant mothers to see the gyna as soon as they know they're expectant, right?
As soon as the pregnant mother knows she's pregnant, she should come to the hospital for urinalysis, so for us to detect on time, because UTI can cause preterm labor. When we have a preterm labor, the baby will have to go to NBU and all that.
Yeah.
Low birth weight, what else? Very many things in pregnancy. Intrauterine growth retardation.
Okay.
Yeah.
Okay.
Yes.
So moms out there, please seek help,
Yes.
or see a gynecologist
Yeah.
for that. Okay. Still on this conversation of UTI, just before we go to the questions, because I know the questions are there and there are many, Daktari, is there anything about UTI that you feel we have left out that is important to mention?
Okay.
Mm-hmm.
I think it is going to mention that UTI can present in a diverse way.
Okay.
It's a system. So it can be asymptomatic. You might be having UTI and you have no symptoms. You might have UTI and you have the symptoms. And I thank God you've asked about the UTI and STI. Those are different systems.
Yeah.
So it is good to differentiate the two. And also it is good to emphasize that if UTI is recurrent, it is good for someone to go back to the hospital and do further investigation. Don't stay at home with UTI, which is recurrent, because it can cause systemic infection. It can even lead to shock.
Oh.
And shock can lead you into more complications.
Yeah.
Yeah. It should be taken as a serious condition.
Okay.
Yes.
All right. Thank you. Thank you so much, Doctor. It's Dr. Doris Mwenda with us on Hope FM. Listen and live. Thank you for your company right here with us. Thank you for all those questions that you're sending right through. We'll be having a look at them one by one, and we'll answer as many as we are able to do so. Now, this one asks, I was confirmed to have these terms with you people are very difficult. Let me just hope I'll be able to read it. I don't know if it's chlamydia or it's CHLA. Then
It's chlamydia.
Chlamydia. There you go. The last 7 years, so I was on medication, but after that I have never gone back for checkup until today. Can it lead to an UTI? Are those two connected?
Those are different. Chlamydia is a bacteria. Chlamydia causes STI. It doesn't cause UTI.
Okay.
Yeah.
Okay.
So it is good for someone to go back to the hospital for further investigation. Repeat the investigation again so that the medication, she can be given the proper medication, he or she.
Okay.
Yes.
And I'm just thinking, Dr. now that you said that sometimes UTI can be asymptomatic or without symptoms.
Yes.
Is there like a recommendation for do check up every now and then so that to establish just in case? Or what do we do so that one is not living with a disease and they don't know that they're actually suffering from it?
The people that we need, the group of people, cohort that we want to have regular checkup, it's only if you have other comorbidities.
Okay.
But if you don't have other comorbidities and you are asymptomatic, you don't have to do investigations. People like pregnant women, diabetic patient, or someone who has a history of kidney disease or kidney failure, or they have abnormal anatomy of the kidney. Such people, they are required to do regular urinalysis or urine culture, but depending on the follow-up with their doctors. Yeah.
Okay. The rest of us, let's just maintain good hygiene.
Yes, let's maintain good hygiene.
Avoid sugar.
Take a lot of water. Yes.
Yeah. And we'll be good to go.
Yes.
Okay, fine. This one says, recurring UTI after every 3 months. After treatment, I go for test and then I find I am okay and there's nothing they can see. But after 3 months, inarudi tena. Nifanye nini? Okay. They say I have also been having UTIs for so many years. Okay, those are two different questions. Let's answer the first one.
Okay, the question is, she has been having UTI. It was treated, and then after 3 months,
It recurs.
It recurs the
Okay,
symptoms.
she goes back for checkup. They find nothing, but then she goes back home and she gets it again and has to go back to hospital.
So for such scenario, it's good when she goes back to the hospital, describe the symptoms, signs and symptoms to the doctor very clearly.
Yeah.
As we said about the symptoms of UTI, if I can repeat again,
Yes.
dysuria, frequency, urgency, or bloody urine, and sometimes abdominal pain. So you have to check on yourself. Do you have vaginal discharge? Maybe we are treating UTI and it is candidiasis or STI.
Okay.
So that is why maybe it is recurring. Your 3 months it is over, and then you come back. Also the hygiene. You should look at the hygiene, avoid sugars, all the things that we listed. Yeah. And the gold standard investigation for UTI, it's the culture. So the best thing is you do the urine culture and also a high vaginal swab to rule out the two.
Okay.
Yes. As we said, sometimes we are treating what the patient doesn't have.
Okay.
Yeah.
Okay, so it could be something. You're saying it could be something else. So she needs probably further investigation.
Yes. Yeah.
Okay. All right. So we have one who asks, this is my question. Is UTI related to candidiasis? Now that you mentioned it, please ask Dr. to explain it a little bit further.
Okay. Thank you for the question. When we started, we said UTI can be caused by bacteria or candida. Yes.
Which is the yeast.
The yeast.
Okay.
STI, we can have bacterial and yeast. These are two different systems.
Okay.
So candidiasis and UTI might be related in a way that is this UTI caused by yeast? And STI, is it yeast? But remember also, candidiasis is not an STI. It's only that it affects the reproductive system.
Okay.
That is the vagina and the cervix. So there are two different things, but it could be the same. It could be, it is one organ, a yeast, affecting different system. So it is wise for someone to go see a doctor, a gynecologist, for differentiation.
Okay.
Yes.
Okay. All right. And still on this conversation of UTI, seems like we have many to ask on this one. Now we're back to the person who was talking about it recurring, and they're saying that they did culture and the culture shows nothing, and then she also has an itch down there. Does that present as a symptom for UTI or for an infection?
Now, as we said, urine culture is the golden standard.
Okay.
Investigator, let me say that.
Okay.
So, if the urine culture is negative, then we don't have UTI. If it is itchy around, I think she meant itchy vagina, then that is candidiasis.
Okay.
And that should be treated with antifungal, not bacteria. Those are two different things.
Okay.
Yeah.
All right.
So that one doesn't have UTI. It is candidiasis.
Okay.
Yeah.
All right. All right. I think that's why you said it's important to to do it to go for a second opinion probably, and after you've gone somewhere and you're not getting the help, it's good to ask again and again and again. All right, so that you're not treating what is not there. Okay, so remember 20933 is our SMS line, 0717 400 555 on WhatsApp, and at Hope FM Live across social media. Okay, so we're back we're off now. Questions to do with UTI, or we're not off really. If you still have a question, you can send it. But I have seen another question that is a bit different, Daktari, and this one is asking what should be the normal color of discharge? Is there a normal color? Is there a color that when you see you should be worried?
Yes, okay. The normal color of vaginal discharge is usually mucoid, cleamish.
Okay.
But for candidiasis, it's thick, milky, whitish. That is abnormal. That is candidiasis. Yellow. There's some STIs which, like chlamydia, the discharge will be yellow. Or if it is green, so any other color,
brownish.
Brownish.
Is
brownish,
brown normal?
cream, not so browner.
Okay.
Like creamish mucoid. That one is normal. But any other color, which is foul smelling, like thick, whitish, milky, or yellow, that is infection.
Okay.
Yeah, I hope you got.
So you mentioned smelly. So normal should not be smelly.
Yes,
that's what you're saying.
normal discharge should not have a foul smelling.
Okay.
Yeah.
All right. There you go. I hope your question is answered, Blair. All right. Remember to send in that question and we'll be having a look at it in just a few moments. Shortly, we will have the news at 12 o'clock. But before then, here is some beautiful music for us to enjoy.